I heard about the earthquake, and the first thing I thought was, where's Nancy, and is her family all right? And so I texted her right off the bat. And I got a text back almost immediately. It's beyond imagining. Pray for me.
It was apocalyptic. The wall started splitting, the ceiling started falling down, and I wasn't really clear about what was going on. And someone from WHO said, Madame, il faut sortir. So I came out, and the earth was still shaking. We were able to cross the city very slowly and saw all the devastation. But there was no time to really reflect because we just had to serve.
Well, obviously, like every American, witnessed it and saw the news, everybody was glued to their television sets and saw the devastation. You can't be a witness to seeing that type of devastation and not have your heart go out to the people of Haiti.
My children's schools were calling and saying, how can we be helped? How can we be helped? Money came in from lots of different places.
Everyone worked and worked and worked, removing people from the debris with their bare hands, bringing water, whatever was needed in any given location, going to look for family members. I would say over 90% of the people working at the hospital are themselves homeless.
When I heard about the earthquake, I knew that the scope of things would be enormous. I knew that on my own I couldn't do enough. My intuition was that Doc to Doc, with a long history of collaboration and partnerships, would also be working with other organizations. And so, of course, Doc to Doc pulled in North Shore, Doc to Doc pulled in Nancy Dorsonville on the ground, they pulled in FlexJet.
FlexJet is a private aviation company with 86 aircraft in our fleet, and we have the operational expertise to fly in and out of the Caribbean. Sandy Titel, within 48 hours of the devastation, contacted me directly and told me about the situation and asked if we would assist in providing the much-needed medical supplies. FlexJet, in partnership with Doc to Doc, was able to, within a week's time of the earthquake, send the first shipment of medical supplies on January 19th. Subsequently, we sent a second follow-up flight on March 6th.
Nancy, as we walk around, because we are going to go to the hospital, can you just tell us what some of the biggest health challenges are here right now?
A lot of the children, because the rainy season has started, have a lot of upper respiratory problems because of the buildings that have fallen and because of the weather. They're sleeping in the wet, in the rain. A lot of the children have diarrheal disease. The quality of the water in general is a challenge. And after such a disaster, it's even more of a challenge. Dis bonjour, fais allô, fais allô. Ah, bravo. That was a smile, you guys.
Between both flights, FlexJet was able to deliver nearly 4,000 pounds of vitally needed medical supplies.
All this came together in an incredibly important way and amplified anything we'd ever be able to do on our own.
Thank you so much.
Of course.
Thank you for your support, guys.
Yeah, well, we're going to come back.